Well, we're here with a little cockatiel by the name of
Misty.
Misty. Misty is a beautiful little cockatiel, and today is about the 16th, I think it is, isn't it? I don't know, I've lost track of time. 16th of October, anyway, round about there. And this little birdie's been brought to me because she's got a lump under her abdomen down here, which we'll show you in a moment. And I've had a quick look at that, but then I've said, hey, there's a lot more going on than a lump. And I'm just wondering what we see, what you see. So just going through what I'm seeing at a very quick glance is that she's got a blockage in one nostril. One nostril is black and full of gunk. Her breathing is laboured. Her wing posture is very abnormal and it's uneven. So she's not holding the wings at the same height. So this one's up higher than this one. We can see her air sacs here going in and out of the front of the neck, which is not usual. So she's got significant respiratory disease, and she's a high candidate for psittacosis or chlamydia in my book, just off the top of my, without having done any tests or any crop washes or anything like that. And we're just going to have a look at the rest of her. And before we do that, I'll just have a listen to her chest and put a stethoscope on her. So we learn a lot from just looking at the posture and the body language of a birdie. Her back is a bit arched. You're a good girl. Very sweet. Very sweet. Now we're starting to see the mass here, and we notice that she's been picking at some feathers on the legs. She's also got a very large callus on this foot, bumblefoot, and she's got problems on this foot. So she's a birdie with a whole series of health problems. Okay. Alright, now with this lump here, this lump is a reducible lump. It means that it's not solid, we can pop it, or we can gently, not pop it, but we can gently put our finger in and put our finger in and put our finger over, and right now the lump is gone, but here it comes back again. The lump's growing in front of our eyes, and we're going to do it once more just for the camera. So here we go, we're just gently, 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 gently disappearing the lump. Right, I can get my little finger in there, but it comes back out fairly quickly. There you are. Watch it grow again as she breathes. It's coming out again, filling up, filling up, filling up, filling up. Okay, so this lump has the features of what we call an abdominal hernia. So this is a hernia and not a tumour. It's not a cancer. And the most common problem that gives rise to this in female cockatiels is oviduct disease and a history of being in poor condition when egg laying, doing a lot of straining, and creating a tear in the abdominal muscle, so that the abdominal muscle no longer supports the intestines and the oviduct and everything, and when gravity is at force, it just pushes and gradually stretches the skin. This lump has been present for about a year, and in due course we will plan to do a skin incision very carefully so as not to cut the underlying intestines and whatever. Have a look inside and repair the abdominal muscle, but this little birdie needs a lot of work to maximise her survival chances of the procedure. The procedure is generally a low risk procedure, doing abdominal hernia repair. However, if we have to remove the oviduct, that is a higher risk procedure, and I would not want to do that on a birdie that I know I can get better in other respects with the respiratory disease, I want to do that first, get these other conditions sorted out and see what we can do about this bumblefoot. Got an abscess, chronic abscess here from faulty diet and unsuitable perches, and on this this foot here we've also got an area pododermatitis or bumblefoot down here. So there's something been going on at home in her management that is not right. We need to get the management right and get her strengthened up as much as we can before we rush in and do surgery. I'll just check her preen gland. Preen gland is abnormal. That's this little thing here. There should be a tuft of feathers there, and there's something, and we've got grease and oil all over here, but it's not a normal looking preen gland. That's that. We're going to have a look at her powder downs across her hips, which are these ones here. And these are not normal either. So we're now getting down to the nitty gritty of what's going on this bird. So these feathers here are totally abnormal. They're very wispy and hardly producing any powder. Hence her plumage is, she's got bright yellow plumage and she's got a brighter head than she'd normally have because she lacks the powder through her plumage. And she has a more bony looking beak than normal in colour because she lacks the powder covering on her beak. And similarly with her legs. Her feet are much pinker because there's no powder on them. So we're now getting down to the nitty gritty of what's really going on, in that she is showing clinical signs that suggest to me that she has underlying Psittacine beak and feather disease. I can't make that diagnosis with certainty without doing blood tests, nor can I make the diagnosis of chlamydia without doing blood tests or doing other evaluations, but they're the things that I think are going on. So both chlamydia and Psittacine beak and feather disease are putting a heck of a lot of strain on her immune system, on her well-being, and if we're going to help her, we need to address the whole picture, not just one problem. So we'll just give her a few moments to catch her breath. We haven't finished looking at her. We haven't done any throat washes or fecal smears to see if she's got parasites as well. She could have a list of other things, but already in a matter of a few minutes we've identified about 5 or 10 problems. So anyway, the person who brought her to me is not the owner, however is acting as custodian for the moment, and I thank you for getting attention for her because she is such a delightful little birdie. She really needs love and TLC, and she deserves that in my book, and I would like to help her given the opportunity. But I need to explain to you a few things in terms of where we can cut corners, where we can go, and what your likely costs are. Okay, so all those factors come into play.